Well, EG5, a new variant of COVID-19, is a highly transmissible, and the World Health Organization is keeping a close eye on its progress. The symptoms are largely the same as other variants, and doctors believe antivirals currently available should be able to treat it. Eloise Amir spoke with Dr. Kyjuan Brown of North Shore Medical for an update on the latest strain.
Health experts believe EG5 is no more severe than other Omicron variants. However, the new variant has been detected in 51 countries, including South Korea, Canada, Australia, the UK, and the US. Dr. Kyjuan Brown of North Shore Medical says summer socializing and travel is pushing up the number of cases.
According to CDC data and data from the United States, EG5 is an Omicron variant and it's the most prevalent at this particular time. So as people are now traveling across the pond to the United States and elsewhere, travel has increased. I'm sure that EG5 will be in our population.
The World Health Organization is monitoring EG5. However, only a handful of countries are reporting hospitalizations related to the virus.
Is it a mistake not to track cases, in your opinion, and will it hinder research efforts?
We do have to evolve with the times. We do understand that now pretty much everyone is immune either through natural immunity, i.e., having the virus infect them, or through the vaccine, right? So, and we're noticing that hospitalizations, yeah, they're going up in the United States about 12.1%. The CDC is showing. However, death rates are not increasing at 0.9%.
The world is still recovering from the aftermath of the devastating pandemic. COVID 19 has killed more than 6.9 million people globally. In Bermuda, 165 people have died from the virus, and 75% of the population is vaccinated. Booster shots have offered additional protection, but experts question if they can keep up with the new variants.
I foresee every year, just like how we get the flu vaccine, we're going to be also getting the COVID vaccine, or they may even combine the two. And that's for individual choice, I hope, and not something that's going to be mandated by government. There's going to be somewhat of a seasonality to the different strains and versions of COVID, right? The summertime, people are normally outdoors or communing. Here in Bermuda, we have May 24th, Hot Match, um, Carnival, etc., where people are herded in very small, confined areas.
While the worst of the pandemic is behind us, scientists believe it's a mistake for governments to view it as a thing of the past. Dr. Brown says the medical community is shifting their focus to treating the persistent symptoms of long COVID 19.
I have had patients recently that have been suffering for months with COVID long haul syndrome, and with treatment, even the treatments that we used before, that patients will recover in 2 weeks. They are taking a little bit longer to recover, actually, but they do recover nonetheless.
A recent study from the CDC shows people are still coping with changes to daily life brought on by the illness, including overwhelming fatigue, a persistent cough, and tremors. While the virus is no longer a global emergency, the question is, will COVID 19 ever go away?
As I mentioned before, we're going to be dealing with COVID for the rest of our natural lives. It's going to be it's a new virus on the market, and it's never going away.
Eloisa Mayers for Bermuda Broadcasting News.
The first new COVID-19 vaccines updated for this fall season are now expected to be available in the United States once they are signed off by the Food and Drug Administration and the Centers for Disease Control.